Hi, I'm Dr. Bruce Sadlick. I'm here today with Amanda Schaefer. She's a functional medical consultant, and we're going to be going over a couple of nutraceutical botanicals. She was kind enough to join me today to give us a little bit of the inner workings on this. So we'll go ahead and we'll start a little bit with, first of all, weight. We all have heard the COVID-20, people have gained more weight. Weight's been more problematic, we've been less active. And it's become problematic, especially for the age bracket 45, 46 above, because we tend to become more metabolic. If we have any pre-existing factors, then unfortunately those factors start coming out, usually genetically around that age bracket. So we're going to try to talk a little bit about a couple of key items to keeping weight down. She'll help us with a little bit of the nutraceutical botanical portion, and then some interesting facts about sugars. So at this point, I'll ask Amanda to give us a little bit of insight on some of this weight gain.
Yeah, so I mean, it's definitely been a stressful and hard time. So I would say, most importantly is just to be really kind to yourself, because this has taken our whole world by storm with the COVID-19, the COVID 20-pound weight gain. And so when we're sedentary and we're told to stay in, not go out anywhere, it's very hard on our bodies. I'm sure a lot of us are used to being out and about, walking around, emotionally and for mood, even being out with people and seeing your friends and being close to your loved ones. It's, one of the more important things that we do in our life. So first of all, I would just say be very kind to yourself during this time. And definitely what I've been talking about with a lot of our providers is that weight gain has been definitely increasing during this time, and that's one of the signs of the metabolic syndrome. And a lot of it has to do with kind of that visceral fat that we see around our waist, just because we're eating more. And a reason for that is there are no regulations for sugar in our diet. And the American Heart Association tells us that, we should have 25 grams of sugar for a woman, 36 grams of sugar for a man, 25 grams per sugar for a child. But a lot of us are eating well over 100 grams a day because there's no regulation in sugar. And unless you're very great about looking at labels and counting those sugar grams, we just don't realize how much sugar we have in a day. So it adds up, with your coffees, your flavored coffees, or going out to eat, desserts. It just definitely adds up. And sugar's sneaky. They put it in things to make it taste good. So you'll have in a lot of things that you don't think it should be in there. So in addressing this metabolic syndrome, like we were talking about, there are some really great products to help with that. Would you like to talk about the berberine with NC2
Yeah,
first?
please fill us in.
Okay, so the berberine with NC2 is made up of two different compounds. Berberine is a plant alkaloid. It's been used in Ayurvedic medicine, Chinese herbal medicine, for centuries. And then the NC2, which is the second component of this product, is two wild-crafted brown seaweeds. These two products synergistically actually help blunt the amount of starch and sugar that enters the bloodstream by up to 48%. So if you look at this product versus starch intake, you're blunting that sugar and the starch into the bloodstream by 48%. So we're almost talking about a 50% blunting. And the reason that's important is because you kind of want to translate that to what it's doing to blunting those insulin spikes that you would have, with these certain meals. And so that's very hard on our bodies, cardiovascularly and whatnot. The synergistic effect of this actually helps lower HbA1c levels, fasting glucose levels, high sensitive CRP, which is a C-reactive protein. So all these different additional parameters cardiovascularly, it's actually helping that as well. So while we're talking about weight gain, it's kind of the secondary benefit to using a product like berberine with NC2, because more importantly, you're addressing all these metabolic factors that you would have with prediabetes or type 2 diabetes itself. So I'm wondering, when you are using this product, tell me what patient you would position this with.
So what we try to do is we try to work upstream. So instead of, if we've got a little bit of a, I call wiggle room, and we could possibly get a little bit of space without putting someone on a medication, let's say like metformin or glyburide or some of the others, if we can dose nutraceutical botanicals and the patient is pretty compliant with diet, we can sometimes just get there without having to implement the use of medications. Or a lot of times we can use very, very low dose medication and then bump up nutraceutical botanicals.
Exactly. Yep.
And then with the dietary, it seems to work very well, kind of harmonized together. Yep. So that's how we've seen that in working with that particular product.
And so with this product, the way you would take it is you would take just the one pill with your 2 largest meals of the day. So if you know you're going to have a pasta meal or something that might be a little bit higher in carbs or sugar, you would take one of these with just that meal, and then it helps blunt the amount of sugar and carbs that get into the bloodstream. So when I've talked to other providers when they've using this medication, some of the patient testimonials that we're seeing, that we're hearing now, is that it's given them more energy. They are starting to see some weight loss, and also there's been like less bloating associated when eating certain meals that are higher carb, higher sugar. And so that overall feeling, that translates to the patient just feeling overall better. Because first of all, they are cognizant of what they're eating, but when they know that they have a product that's going to help, with the insulin sensitivity, kind of blunting the sugar and carbs before it goes in the system, then they're working, that way as well. So it's kind of like they have this awareness, and then they just feel better, more energy. Mm-hmm. That weight loss is secondary, like we talked about, but then it also addresses all those important cardiovascular markers that we see with patients with metabolic syndrome. So it's kind of a 2-for-1 win.
Yeah, definitely. And the kind of being preventative, monitor your blood glucoses. When you go in for yearly exams every 6 months, ask your provider if they can to get a hemoglobin A1C. And especially if you have family members, distant or close, that have the genetic predisposition, always try to work upstream rather than try to connect and correct as time goes on. Yes. So that tends to work very, very well. Any dietary items that you suggest? Are you more into the high protein?
Yeah, it depends on what your patients, what works into their lifestyle. I always talk about just, what's going to work for you, because it has to be sustainable, right? We have to work in what's going to be sustainable. And I think once patients and people start to have the awareness of how much sugar is in food, and you can look on those packages, and I think it's going to be next year, 2022, they're going to start saying anything that has added sugar has to be labeled. So on our nutritional labels now, you'll actually see added sugar grams. So that will be really helpful for patients just to have that awareness. And we're not talking about stopping cold turkey. We're just saying, have that awareness. Say, oh my gosh, if I have a choice between this and this one has less sugar, for your health that you're doing, something great for your health if you choose the one with less sugar. And I always tell people there's a healthier alternative to every food out there. It's just working with someone to find that food for you, or just doing a little bit of research. But just having that awareness around sugar, first and foremost, how much sugar you're having in your diet, it will be so beneficial for you to lessen inflammation and all these cardiovascular markers that, can be a side effect of having too much sugar in your diet, which then causes weight gain, and then you just trickle down that road towards metabolic syndrome. So just having that awareness. One other point, we were talking about sugar grams earlier. When I showed this graph about how this berberine with NC2 by Zymogen works, they were saying that the mean intake of sugar for people in the year, and if we're talking pounds, is 142 pounds of sugar is how much people are eating a year. And then the American Heart Association recommends 22 pounds of sugar a year, that we shouldn't have more than that. So if you really break that down, we're talking about 2 tablespoons of sugar versus 7 tablespoons of sugar a day. So again, just the awareness of how much sugar you have in your diet, looking at labels, that's a great start. And then they say that the reason that the sugar pounds add up over time is because we technically drink a lot of our sugar. So if you have that awareness and you pull back one soda a day or one sweet tea a day, or choose some beautiful water with lemon or cucumber, whatever, lime, whatever you choose to give that water some flavor, you're starting to really cut out those sugar grams. So that's the first place that you could start, just to kind of start where you want to pull back some sugar.
Neat stuff, and stuff that's pretty easy to do, and it can be corrected.
Yes, it can, absolutely. Just having a little bit of awareness, being kind to yourself, taking your time, figuring out what works best for you for sustainability, it absolutely can. They talk a lot about how these chronic conditions actually can be reversed. So there's always hope. There's always hope, and there's great products to get you on your way, to make you feel better, more energy, better mood, and help you with that weight loss.
What about the patients that need more of a guided approach? We talked a little bit about meal replacement. Can you give me a little bit of information on that?
Sure. So there is a product that has the NC2, so it has that carb blocker for starch and sugar. So it has that 2 wild-crafted seaweeds in it. And it's actually, as Dr. Sedlick mentioned, it's a meal replacement. It's a shake. And I'm wondering if I have like a sample of it.
And that's kind of a package.
Yes.
Is it simply just mixed with water?
It can, yes. You can choose to mix it with water. This is our Opti Cleanse, and it's for GHI, so GI, hepatic, and also for inflammation. But we also do make another shake with the NC2. So depending on how you like it, if you chose to do one of these shakes as a meal replacement, it's very simple. You open up the package. You can choose to pour the whole package in either some almond milk or some water.
Okay.
This is mine. I just pulled it out of my bag. I use this when I'm driving around all day and I'm talking to my providers and I don't have time to stop for lunch. I'll just mix this with my water bottle and shake it up, and it actually tastes so good. You can choose to use this with a smaller meal as well. It doesn't necessarily have to be a meal replacement, but a lot of times to get people going, they like to just do like, I'm going to do a shake for breakfast. It has a full multivitamin in it, this one in particular. It has 21 grams of protein. It has green tea extract in it, quercetin, NAC, great antioxidants, anti-inflammatory agents. And I've noticed with these shakes, I don't have any bloating. I'm satiated for hours, and this will carry me through lunch. So if you'd like to get going and you want to see some weight loss immediately, you could definitely do a meal replacement. And when I say meal replacement, I mean this is a well-rounded, it has fiber, it has protein, it has good fats in it, and it actually has a little bit of green. So you're kind of getting a well-rounded meal, and you can choose to drink that. So
interesting. And then that would contain, is it 1 or 2 servings of this?
So if we did, it's called Opti Metabolics. It's a little bit different from this shake. It would have 2 servings of the NC2 in it. So it would have 500 milligrams of the NC2. So technically, you wouldn't even need to take this pill if you chose to take one of the Opti Metabolic shakes.
And does that also come with a dietary regime? Or is it pretty much the physician tells the patient?
Yeah, you work with your patient and you tell them, like, you could do this once a day, you could do it twice a day. Some
with
people
vegetables or salad.
Exactly. Like you could if you chose to do like you said, a small salad with some protein and half of this bag if they chose, or a full shake. Depending on what they wanted to do. But yes, or you could actually make it into a smoothie and add in some hemp seeds and maybe some banana or lower glycemic berries, or a little bit of almond butter, and then it would be very satiating. And this would probably carry them for a few hours, like probably 5 to 6 hours. So Excellent. It could be a true meal replacement.
Thank you, Amanda.
Yes,
I appreciate it. And we'll roll on. Thank you, everybody. Yeah.